Hello and welcome to the video on posterior body regions. The picture on the right hand side will be the image that we use to kind of guide our way through the instruction for this topic. Just to begin going through the different body regions. The first region is the cephalic region. So this is like the head and the skull region. So this is just sort of a general category. Something for you to remember with a lot of these is some of these are very like general body terms that we'll end up learning like other subparts of later on, and other things are a bit more specific. So the cephalic region is one that's a little bit more general, referring to the entire head and skull. But then the occipital region, we have the rear portion of the skull. This is like the visual processing center. So this is like the lower rear portion of the back part of the skull. So for the next one is femoral. So here we're talking about the upper leg. I realize this is one that's included in the posterior region video. The femoral section of the leg can also refer to like the upper section of the front of the leg. So that's something to be aware of. Like the femur, right, is the big bone in the thigh. So that's really what we're referring to here. So then the next one is sural. So the sural region is the back of the lower leg. So think of this as like where the calf muscle is located. So back portion of the lower leg there. Popliteal is the back portion of the knee. Right, so you think of this as like the armpit of the knee, I guess, if you want to think of it that way. But yeah, the back portion of the knee, popliteal. And then gluteal is located on the back of the pelvic girdle at the end of the femur. So you think of the muscles of the glutes, one of the largest muscles in the lower body. So we'll talk about a lot of the like the hip extension that kind of works from that position. But it says located posteriorly to the pelvic girdle. So you think of like the pelvic bone here, sort of like that bowl-shaped bone that eventually the vertebrae all stack on top of. And then at the proximal end of the femur. So it's good to begin practicing with some of those terms. Remember, proximal means near, distal is far. So the femur, right, is the bone of the upper leg. So the gluteal region is at the proximal end, at the near end of the femur. So again, it's good just to see some like carryover from some of that earlier vocabulary. The sacral region is the bottom of the spine. So this lies between the fifth segment of the lumbar vertebrae, so the L5, and the coccyx, which is the tailbone. So the joint in your back that can sometimes cause people issues is the SI joint. So it's the sacral iliac joint in the lower back, but it's a common location for like lower back pain from people. The bottom part of the spine there is sacral. So lumbar then are the 5 vertebral sections of the lower back. So talked about the L5 up here. They are numbered, right, L5 through L1. So a lot of lower back injuries will potentially happen in the discs in between those regions. So that's one that we'll talk about quite a bit. It may be something that you've heard of in the past, in that kind of a context. But then the vertebral region are the 33 individual bones of the spinal column. So I was saying to you before that some of these terms are kind of general. So this will start like all the way up in the T-spine that is extending up, relatively high in the back, going all the way down through the lumbar in the lower back. So we'll talk about like all those different regions of the vertebral column. But then the last one is the scapular region. So the scapula is like the big bone, like shoulder blade bone in your upper back. So the scapula is important when it comes to stabilizing a lot of the musculature in the upper back. It's something that if is sort of functioning well, it slides, like the scapula basically slides as you move the arm into extension. And then it's something that would retract and move in like more towards the spine. Oops, sorry. It would move in more towards the spine when like you're pulling something like in towards your body. So you can imagine like if you were say like doing a rowing motion, we think of that like in the gym, the scapula would retract and move back this way. Whereas if you were throwing a punch, say, the scapula would then slide laterally. So the scapula should slide and move freely in a healthy individual. But this image is the final one for the video. Again, this just shows you like an overview of the posterior regions. Some of the things, as I mentioned to you, are things that are not specifically limited to the posterior region, but it's good to become comfortable with these terms. So you'll generally see these in a matching setting. It's good to get comfortable with the diagrams and understand how some of these terms are specific, whereas others are a bit more general, and we'll kind of go through and fill in some of the gaps for those other terms as we work our way through the year. But thank you for taking the time to watch the video, and please make sure that you answer the questions in the assignment at the end.